I carried out a poll of nearly 300 vein experts, and Veinlite was by far the most commonly used aid to sclerotherapy. In this video, I'm going to explain why Veinlite and similar transillumination devices are so popular, and I will cover what Veinlite is, how it works, how it is used, and I will show you a demonstration of vein experts using it to treat leg spider veins by sclerotherapy. Hello, my name is Dr. Haroon Gadraj. I'm a vein expert with years of experience of running a successful private clinic. I'm here to offer training and mentoring, coaching and support to healthcare professionals who run their own clinics and private practices, not just those who are involved in veins. Let's get started and stick around to the end, where I will also show you 2 simple tricks you can use to improve your Veinlite assisted sclerotherapy of reticular veins. Those feeder veins you really must inject before you start injecting the spider veins directly. And this will lead to much more successful microsclerotherapy results. The orange LEDs are optimized for lighter pigmented skins and superficial veins. To turn them on, press the orange button, and to turn them off, press the orange button again. The red LEDs are optimized for darker pigmented skin and deeper veins. To turn them on, press the red button, and to turn them off, press the red button again. How does it work? Well, Veinlite produces a ring of bright light which is focused down and to the center of the ring. When a Veinlite is placed on the skin, the bright uniform illumination illuminates the superficial tissues inside the ring. The deoxygenated blood in veins preferentially absorbs the light, so the veins show as dark lines within the illuminated area. Placing gentle traction on the Veinlite stretches the skin and engorges the vein for easier needle insertion through the opening in the ring. How is Veinlite used? In relation to leg spider veins, I use the Veinlite to find feeder reticular veins. I will scan the area deep and adjacent to the leg spider veins by using a systematic sweep of the area. I literally scan the area with the Veinlite. In light-skinned patients, I will use the orange LEDs. When injection is successful, the reticular vein will disappear as deoxygenated blood is displaced by the clear sclerotherapy solution, which reflects the light rather than absorbing it in the way that venous blood does. Here are examples of the injection technique as reticular veins are successfully injected. Look how they disappear. The Veinlite can be placed in a plastic sleeve to reduce the risks of transmitting blood-borne infections, and I think they should be used routinely. The Veinlite also has a very handy hood to improve visualization in bright environments. Now, at the beginning of this video, I told you that I would show you 2 simple tricks to improve Veinlite-assisted sclerotherapy of reticular veins, those feeder veins which should be injected for successful treatment of leg spider veins. Well, here's my first tip. Reticular veins lie just deep to the skin at the junction of the dermis, and therefore you should inject at an angle of about 5 to 10 degrees to the skin. This way is very different to what you would do when you're injecting the spider veins directly. When injecting leg spider veins after you have injected the feeder veins, you should place the needle flat on the skin. Whereas many vein experts bend the needle to inject spider veins, this is not necessary for feeder veins, and most vein experts use a straight needle to inject reticular feeder veins. My second tip is to aspirate before injecting the feeder veins. As the reticular veins are somewhat larger than spider veins, usually between 1 and 3 millimeters in diameter, you should be able to confirm that the needle is in the vein by gently aspirating. Don't draw back too hard, otherwise the vein walls will collapse around the needle and you won't be able to aspirate. Once aspiration is successful, the vein can be injected. Blue reticular veins, in association with the telangiectasias, are treated first. The sclerosant is injected slowly up to a maximum of 0.5 ml for any single vein injection site. And of course, injection must be stopped if resistance is felt, if the tissue around the injection site becomes raised, that's a bleb, if the skin around the vein blanches. At regular intervals, the patient should be asked to bend the ankle up and down to promote the flow of blood through the deeper veins to minimize the risk of gastrocnemius vein thrombosis. Here's a bonus tip that you don't hear very often. Once a reticular vein has been injected, pressure on the syringe can be maintained for 10 seconds without actually injecting any more sclerosant. This allows contact between the sclerosant and the endothelium for longer before it is washed away, and this may actually improve efficacy. In the description box below, there's a link to my free mini course, How to Inject Leg Spider Veins and Blue Veins by Microsclerotherapy. In this free guide, you'll find more tips for successful injections. Now, if you found this information valuable, please consider hitting the like button. It really does help my channel. And please check out all the links in the description box below. Why not subscribe? And that way you won't miss my next video. Now, do you use Veinlite for sclerotherapy? Do you have any tips or tricks of your own that you could share? Why not leave me a comment or a question? I look at all the comments and I promise that I will get back to you as soon as I can. Thank you for staying to the end and thank you for watching.